A warm greetings to everyone. Today, we will be delving into the topic classification of periodontal diseases with your presenter, Dr. Radhika, Associate Professor from the Department of Periodontics, Chettina Dental College and Research Institute. What is classification? It's a systematic collection of data or knowledge and its arrangement in sequential manner in order to facilitate its understanding. Use of classification either to assess the etiology, pathology, diagnosis, prognosis, and treatment planning, and also to facilitate communication. According to American Academy of Periodontology classification, gingival diseases are classified into plaque-induced and non-plaque-induced. Chronic periodontitis are classified into localized or generalized. Aggressive periodontitis is subclassified into either localized or generalized. Periodontitis as a manifestation of systemic diseases such as hematological disorders, genetic disorders. Necrotizing periodontal diseases can either be necrotizing ulcerative gingivitis or necrotizing ulcerative periodontitis. Abscess of periodontium can be gingival, periodontal, or pericoral in nature. Periodontitis associated with endodontic lesions can be uh, combined periodontic and endodontic lesions. Developmental or acquired deformities and conditions can be localized tooth-related factors, mucogingival deformities, and occlusal trauma. Dental plaque-induced gingival diseases can be subclassified into gingivitis associated with dental plaque only, gingival diseases modified by systemic factors, gingival diseases modified by medications, gingival diseases modified by malnutrition. Whereas non-plaque-induced gingival lesions can be subclassified into gingival diseases of specific bacterial origin, gingival diseases of viral origin, gingival diseases of fungal origin, gingival diseases of genetic origin, gingival manifestation of systemic conditions, traumatic lesions, foreign body reactions, and finally, not otherwise specified. Dental plaque-induced gingival diseases. Under that, gingivitis associated with dental plaque only, subclassified with local contributing factors, without local contributing factors. Gingival diseases modified by malnutrition are ascorbic acid deficiency and others. Gingivitis modified by medications, example, drug-influenced gingival diseases. Gingivitis modified by systemic factors. Under endocrine system, it can be puberty associated, pregnancy associated, diabetes associated, and the blood dyscrasiasis, leukemia associated. Non-plaque-induced gingival diseases. Under bacterial origin, it can be of Neisseria gonorrhea, Treponema pallidum, Streptococcus species involvement. Gingival disease of viral origin example is herpes associated, of fungal origin or example Candida associated, of genetic origin example hereditary gingival fibromatosis. Non-plaque-induced gingival diseases under manifestation of systemic conditions such as mucocutaneous lesion, allergic reactions, reaction attributed to dental products. Next one is the traumatic lesions and foreign body reactions. Periodontitis. The various clinical features of periodontitis are inflammatory changes, pocket formation, and bleeding on probing. Periodontitis can be further classified into chronic, which is subclassified into localized and generalized, aggressive into localized and generalized, and less common type of other periodontitis are periodontitis as a manifestation of systemic disease, necrotizing periodontal diseases, and periodontitis associated with endodontic lesions. The term localized is used when less than 30% of the examined site is involved, and it's used generalized when more than 30% of the sites are involved. Chronic periodontitis characteristics. Adults are more common. Amount of destruction consistent with local factors. Variable microbial pattern. Subgingival calculus are found. Slow moderate progression rate and modified by other factors. Further divided into localized and generalized, and also under slight, moderate, and severe categories. Aggressive periodontitis. The primary features are non-contributing medical history, rapid attachment and bone loss, amount of destruction not consistent with local factor, familial aggregation of cases. Secondary features Aggressive bacterial actinomycetocomitants are involved. Abnormal phagocyte functions is seen. Hyperresponsive of macrophages are observed. Self-arresting in nature in few cases. Localized aggressive periodontitis shows features of circumpubertal onset, localized first molar and incisor with proximal attachment loss on at least two permanent teeth, one of which is a first molar. Robust serum antibody response is seen. Whereas generalized aggressive periodontitis, commonly seen in more than 30 years of age, generalized proximal attachment loss on at least three teeth other than first molar and incisors are observed. Episodic nature of destruction, poor antibody response is observed. Periodontitis is a manifestation of systemic disease under that associated with hematological disorders, associated with genetic disorders. Necrotizing ulcerative periodontal disease are further subclassified into necrotizing ulcerative gingivitis and necrotizing ulcerative periodontitis. Abscess of periodontium are further classified into gingival abscess, periodontal abscess, and pericoronal abscess. Periodontitis is associated with endodontic lesion. In endodontic lesion, it can be a primary endodontic lesion or primary endo with secondary perio, or a primary perio with a secondary endo, or purely primary perio, or a true combined lesion given by Feynman et al. Classification. So this is a pictorial image which shows a primary endo lesion, a primary perio lesion, a secondary perio lesion, a secondary endo lesion, and finally the combined lesion where both endo and perio are involved. The various pathways through which the endoperio lesions occurs, that is, in apical foramen, vertical root fractures are the various etiology to occur an endoperio lesion. Development or acquired deformities and condition. Under that, localized tooth-related factors that modify or predispose to block into gingival diseases periodontitis are observed. Mucogingival deformities and condition around teeth are seen. Mucogingival deformities and condition on indigenous ridges are seen. And finally, the occlusal trauma, which can be further subclassified into primary and secondary in nature. Local tooth-related factors cause disease by enhancing plaque accumulation and removal. Example, tooth anatomic factors, dental restoration or appliance, root fracture, cervical root resorption. Mucogingival deformities around teeth such as gingival recession, lack of catenized gingiva, decreased vestibular depth, aberrant crinum, gingival excess, gingival enlargement. Mucogingival deformities around edentulous ridges, example, vertical horizontal deficiency, lack of gingiva, keratinized tissue, aberrant crinum, decreased vestibular depth. Occlusal trauma are two types in nature, either primary or secondary. Thank you for listening.